Hi, I am Dr. Muhammad Asif Sayyed, PhD scholar in epidemiology and public health at Liaquat University of Medical and Health Sciences, Jamshoro. My abstract topic is pesticide and chemical as a potential risk factor of aplastic anemia, a case control study among Pakistan population. As we know that aplastic anemia is a life-threatening hematological illness which reduces the ability to produce red blood cells, neutrophil, monocyte, and platelets. It is characterized by the combination of peripheral pancytopenia and bone marrow hypercellularity. Global incidence is range from 1.4 to 14 cases per million population. Aplastic anemia is an immunologic pathology and is initiated by certain environment and host related factors such as certain environmental chemicals, medical drugs, infection like seronegative hepatitis, and complication of pregnancy. The objective of this study was to investigate the association of aplastic anemia with exposure to pesticide, certain environmental chemicals, and family history of illness, that is aplastic anemia. A hospital-based case control study with 191 cases, 696 control was conducted from 1st January 2015 to 31st December 2018 in Karachi, Sindh. Cases were identified as a patient with diagnosis of aplastic anemia confirmed with bone marrow biopsy, while control were identified as a person without aplastic anemia or other hematological illness or chronic disease. In-person interviews were conducted by using a closed-ended questionnaire to collect demographic information, family history of aplastic anemia, history of pesticides, and other chemical exposure. The adjusted odd ratio with 95% confidence interval were estimated and p-value less than 0.05 was considered significant. Total 191 laboratory confirmed aplastic anemia cases were identified. Mean age was 29 years, while the range of the cases were from 4 to 69 years. Male were predominant, that is 67.5%. The most common age group was 16 to 30 years, which is 40%. Among the type of the aplastic anemia, the highest number of cases, that is 49%, were found in the moderate type of aplastic anemia, followed by very severe type of aplastic anemia. The strongest association were observed between aplastic anemia and family history of aplastic anemia, that is the adjusted odd ratio 13.3, exposure to pesticide adjusted odd ratio 2.1, and exposure to chemical adjusted odd ratio 3.6. On the basis of our conclusion, the study observed a significant association of aplastic anemia with family history of disease, exposure to pesticide, and the insecticide. However, on the basis of our conclusion, we recommended to establish this connection. Further longitudinal studies are warranted. Thank you so much.